This is an interesting slide that shows some hope for America in general and our young people in America, and you might ask why. But on your left is data from Korean veterans that died in the war around age 20 to 25 of trauma, of blasts, of bullet wounds. And they had autopsies, not every one of them, but a significant number. And the dark blue is the presence of any evidence of plaque or atherosclerosis in the arteries. And the light blue is the presence of severe plaque. Well, you talk about 20 to 25-year-olds, 80% had some evidence, and about 15% actually by that young age already had at least one artery that was severely clogged with atherosclerosis. You know, Korean War, McDonald's was rolling big time. America was smoking like fiends. Medical care wasn't very advanced, or detection and lab work and such. The next two bars are the Vietnam and the Iraqi Desert Storm experience. The hopeful news is these severe plaques have actually diminished, and the presence of plaque in these very young people have diminished. A lot of people say, why? Because in general, I'm not that optimistic we've gotten that much healthier than the 1950s, but smoking rates have dropped a lot. In fact, last week it was announced it's the lowest smoking rates ever in the history of the United States. Thank goodness. Our ability to treat blood pressure with a single pill, our ability to lower cholesterol with a single pill is much more widely available, and unfortunately there are actually 20 and 25-year-olds that are on those medications. So atherosclerosis at this young age is still an issue, and in fact, these are 20-year-olds. By the time you get into your mid to late 30s, we do see a lot of heart attacks from atherosclerosis. So you are undoubtedly aware, but it is also not just Groundhog Day, it's Heart Month, February, that for 102 years, heart disease has been the #1 cause of death in the United States. It actually began in 1918. There were still more heart deaths in 1918 than flu deaths, and every year since. There is a little competition going on with cancer rivaling heart deaths. In a couple states, it slightly exceeds it, but as a total country, heart deaths are still #1, cancer #2, and often the next thing put down there is something like emphysema, chronic lung disease. That's not an entirely true and honest list that's often put out. This is from the American Heart Association, because if you look at that pink box, you can see the biggest circle is heart disease, the second biggest circle is cancer, but according to studies at Johns Hopkins University and other locations, actually being in a hospital and being a patient is the third leading cause of death, medical errors. Rather frightening idea, the wrong drug, the wrong blood transfusion, the wrong operation, the bed sore, the infection that doesn't respond to antibiotics. It's a real deal. I'm a frequent reviewer of medical charts to assist attorneys in defense or other such matters in the court. And the number, in fact, last night and this morning, I was finishing a report about the inadvertent administration of a drug dose to a young woman 10 times higher than was supposed to occur, and it caused a heart attack. This stuff really does happen. A very important clue there is not to depress you on that topic, but be healthy so you don't need a hospital very often. You know, visit other people and be kind and get the heck out of there and don't eat in a hospital. But if you can design a life where, you need a medical team, but hopefully it's a rare and outpatient experience, you have the best chance of avoiding the third leading cause of death in the United States. Quite an amazing statistic, actually. So why do we clog our arteries? How do we go from 50,000 miles of beautiful pathways, clean, healthy endothelium, no cholesterol crystals inside the arteries, no accumulation of white blood cells and fibrous tissue, to the fact that by age 40, 50, 60, 70, and certainly beyond, it is the predominant cause of disability and death? What the heck is happening to us? Well, if you look at just, you can learn from different ways. You can learn from basic biochemistry. You can learn from epidemiology. You can learn from the holy clinical trials. But there was a rise in the number of cases and deaths from heart disease that was noted. It's a disease that's been around. In fact, there have been a number of studies in the last decade of mummies. Can you imagine a research project where you take an Egyptian mummy to a hospital and you do a CT scan to identify that the blood vessels are calcified in age, and they are. There was, anybody know who Otzi the Iceman was? You guys know Otzi the Iceman was a Neanderthal wanderer who fell in a crack 5,000 years ago in Europe and was frozen intact with his body preserved as well or better than any other 5,000-year-old, other than George Burns to his last few days. And at any rate, Otzi has been the source of many, many studies. It's been written up in Scientific American. It's OTZI if you have any interest. It is pretty fascinating. But Otzi, the Iceman's arteries, are quite involved with atherosclerosis. They actually did gene studies on Otzi, the Iceman of all things, and he inherited a gene called 9p21 from his mom and dad, Mr. and Mrs. Otzi. And I don't know exactly the rest of his diet and such. I believe he died with either an arrow or a blade, so he was a traumatic death. Not of a heart attack, but he died with heart disease. So the disease has been around, but World War II in the United States, when it ended, was a joyful time, I'm told. I'm not quite able to recall anything till 1959, and I came into this world, crying, screaming, and kicking. But the late 40s and early 50s, the grand time of 50% of America smoking, and food supply and food companies like Kraft really starting to develop options for us. There was a big spike in heart attacks. A lot of it was male. Females get a little advantage on average till post-menopause. And there were a lot of people dropping dead. That prompted an evaluation. Why do people have heart attacks? That's why the government started funding something called the Framingham Heart Study. You may have heard of that outside of Boston. 1948, right after World War II, they had to answer the question. When Eisenhower had his big heart attack in 1955, it prompted even more funding and questioning, why do people have heart disease and heart attacks? It really wasn't well known. The general concept was it's just a disease of age, your arteries clog up, but indeed there are people I take care of in their late 80s, early 90s that have no detectable atherosclerosis. It's not inevitable. There are famous examples like Mr. Nathan Pritikin, who ran the Pritikin Center and for majority of his adult life ate a very healthy diet and had a lot of fitness and good lifestyle, who had autopsy at his request, had super clean arteries. So there are examples of it, but this spike prompted us to dive deep. And as I said, if you drive outside Boston, you can go visit the town that changed America's heart, because there was funding, and that's 1948 that it started. The Adventist Health Study was funded in 1958. So it was by the 1960s that we started to get some clues, of which cholesterol was one of the clues. And you can see the Framingham study began. The term risk factor, you've probably heard that. You know, risk factor is really important, actually, just so you know. Even in your conversation with your friends, family, peers, you know, smoking is a risk factor for lung cancer and heart disease. But there are some smokers over 100 that have never developed those diseases clinically. A high cholesterol, we'll talk about, is a risk factor. It's not the risk factor, and that's a subtle but important. High cholesterol is a risk factor. There are people with a cholesterol 325 that don't apparently have clogged arteries, and there are people with a cholesterol 150 that don't haven't avoided clogged arteries. It's part of an equation I'll talk to you about. But it is statistically, and for you, I mean, not wearing a seatbelt is a risk factor for dying in a car accident. Now, hopefully you'll never have a car accident, and you could go through life without your seatbelt on. But it's a wise, decision to pay attention to risk factors. And then they keep on doing and publishing and following. They're actually still following the grandchildren of the original Framingham participants as to their health. And we've learned a lot. It's not perfect, but we've learned, the issue that if you know risk factors, if you know that the person having bypass probably had an issue with their blood pressure, blood sugar, cholesterol, smoking, fitness, genetics, why don't we pay attention to people 10 or 15 years earlier, turn the sink off, turn the things that drive disease off, and then we don't have to crack your chest and put in stents and operate on your leg arteries and take blue pills for things that should happen naturally during our life. Turn the faucet off. This is a slide, if you've not seen very often, used by Dr. Dean Ornish, but it's also sometimes credited, if you know the name, Dennis Burkitt, who was a physician from England who spent a lot of time in Africa. He's often considered the king of fiber. He thought if we all just ate more fiber, and I can assure you there's no fiber in chicken or beef or pork or eggs. If we ate more fiber, we'd turn off the faucet of a lot of chronic diseases, and we still believe that.